I've always wanted to help people that always thought there was nobody that cared. And people that suffer from mental health illnesses think that they feel like a lot of people don't care. So I get the opportunity to go out and show them that there are people that care and want to help.
The crisis team is comprised of people from different disciplines. So there are psychiatrists like me, there are psychologists and nurses, but in some ways the real heart and soul of the team are social workers who know the community very, very well. They know what resources are available in the community. They know the other providers by first name, so that when you contact our team, we're able to figure out what you need and get you connected with the right people fast.
Because the goal for every patient is you want to live at home, you want to be able to go to work, you want to be able to go to school. You don't want it interrupted by bouts of having to be put into a hospital setting. That's what an ESP does.
I have, and my clinicians have years of experience. We know how to navigate the system. If you can call the CEO or even the person who's the clinical director and say, listen, I have your patient, we're working with him or her, and what can we do about coming up with a plan to keep them safe in the community?
I've been in the system for a long time, and in years past it was always forced care. You're sent right to the hospital.
The ESP providers help us because they know the resources in the community much better than we do. Plus they have the specialized training, the specialized knowledge, the specialized experience in dealing with these types of situations than that police officers just aren't trained and properly equipped or educated to respond to effectively.
By having this ability to intervene in crises way upstream, we're able to avert a lot of unnecessary hospitalizations.
They're absolutely a critical resource at our hospital and a very important asset to all of our team of providers that are at the hospital. They're there on a regular basis to help assess behavioral health issues, work with physicians and nurses and other staff to determine the appropriate placement for patients with behavioral health issues.
I can suggest that you go to the Crisis Stabilization Unit. We could help you with getting your medication because you would see one of our psychiatrists while you were still there at the Crisis Stabilization Unit. We can also make sure that your primary care is put in place, your therapist services are put in place, your psychiatry services are put in place. So it's really, really important. The Crisis Stabilization Unit is very important. The biggest part of that, you stay within your community and your family is able to come see you.
One of the most remarkable developments in recent years has been the development of a new specialty in our field called certified peer specialists. These individuals are people who have had significant psychiatric challenges in the past, but are now in a state of significant recovery.
As my role as a peer specialist, I'm really there to support the person who is in a crisis. So with saying that, if there's police involvement, I usually try to offer my experience of how it might feel to be talked to a certain way or treated a certain way, and maybe offer like some information about what this person may be going through.
What's particularly important in an ESP is that it's community-based. It's a community agency. It's a community set of providers that work as part of a system of care in the community. But our focus is really individuals in the place that they live, and when they're in crisis, we work with the system of care.
The team concept of care is so important.
I think that it's important for people to have a place to go or people to talk to when they're experiencing sort of extreme states or in crisis.
I turned to our local ESP providers for assistance to train our police department and to co-respond. So we had the ESP providers train our whole police department in the signs and symptoms and how to appropriately respond to people with mental illness.
Emergency services referred me to the clubhouse, and the clubhouse has saved my life.